Clinically proven natural solutions for rheumatoid arthritis. In this video, we're going to be talking about what is rheumatoid arthritis, what are the symptoms, what are the diagnostics, but most importantly, what you can do to get relief now that is safe, natural, and clinically proven. So, rheumatoid arthritis, also commonly referred to as RA, it's a chronic inflammatory condition that affects the connective tissue, and it typically starts in the joints, but it's not limited to the joints itself. Now, most people they just associate it with the joints because of the term arthritis. The thing is, this can actually affect other parts of the body as well. Organs like the heart, the eyes, the nerves, kidney, skin, the entire circulatory system, and even the lungs. and It's an autoimmune condition. What that means is the body's immune system is actually attacking its own healthy tissue. And in this case, the synovium, which is the lining of the joints. And That's what actually becomes inflamed and can result in certain symptoms. Now, in this video, I'm going to be talking about rheumatoid arthritis just in relation to the joints, not the other organs that it can affect as well. So before I get to the remedies and the diet, what can be done about it, that's what my video is about, giving you solutions, not all the bad information. Let's just go through some of the, briefly, what the condition is, how it presents, and how it's diagnosed. So the common symptom, obviously, is joint pain. That's the number one symptom, along with swelling and tenderness of the joints. And typically, the joints that it starts in is the fingers. It can also affect the feet, the wrist, and as I said, affect other parts of the body as well. There can also be warmness of the joints, warmth of the joint. So when you touch the joint, it can actually feel a bit warm. Stiffness, especially in the morning of the joints, and then there can be difficulty in moving those joints as well and carrying out many daily activities due to that. Um, Long term, if this is not treated, it can result in deformities of the joints. So it's really important to get under control. Now, there can also be certain other types of pain associated with this, like back pain or muscle pain that's often associated with it, and other symptoms like fatigue, loss of appetite, even a low-grade fever. And as the condition progresses, and if it's not properly managed and it starts to advance, it can start to affect other organs. As I mentioned, other organs do get affected by it, and those organs will develop symptoms like, for example, if it affects the eyes, then you can get dryness, pain, inflammation in the eyes. If it's affecting the heart, it can actually damage the cardiac muscle. Now, don't confuse this with rheumatic heart disease. That's different. That's caused by rheumatic fever. This is to do with rheumatoid arthritis. It's different. Rheumatic fever is an infection. Rheumatoid arthritis is an autoimmune condition. um, Also, long term, it can reduce your blood cell count. I mentioned it affects the lungs as well. It can be inflammation and damage to the lung tissue itself, which can result in difficulty breathing. Now, I know I'm giving you a lot of really scary information, so I'm not going to go any further with that. The point of this video, as I said, is for the remedies. Next, let's just go through briefly how the diagnosis is typically made. Now, the first thing on this list is RA factor. That's rheumatoid factor. That's actually an antibody. Anti-CCP is also an antibody. CCP stands for cyclic citrullonated peptide. And these are basically two antibodies that can indicate that a person has arthritis, rheumatoid arthritis. CRP, which stands for C-reactive protein, and ESR, which stands for erythrocyte sedimentation rate, these are known as markers of inflammation, inflammatory markers. Now, they can be elevated in many conditions, but when these are all associated with each other, and along with the symptoms, or multiple or all of the symptoms above, then it can indicate that the patient has rheumatoid arthritis. Now, uh, CRP and ESR can also be elevated in other conditions. It's very common to find these elevated, even in infections. So just because those are elevated doesn't mean you have arthritis, rheumatoid arthritis at least. Now, I did mention radiology as well. That's the probably the obvious one. X-rays, ultrasounds, MRIs. That needs to be done usually in the more advanced cases to check for things like erosion and the development formation of deformities. So typically, that's how a diagnosis is made. When you present with these symptoms, and then you find that these the blood tests or these biomarkers are elevated. So that's typically how the symptoms and the diagnosis of rheumatoid arthritis are carried out. Now, as far as causes go, I didn't put uh, any list of causes, and that's because the exact cause, the official answer to the question is it's unknown. However, there are studies suggesting that certain things can are associated with the development of autoimmune conditions, like certain nutritional deficiencies. Like vitamin D is a very common one. Almost every autoimmune condition, person with an autoimmune condition tends to be deficient in vitamin D. However, there's a lot of debates on that as well. And then there's certain infections that are associated with rheumatoid factor. That's going to be things like E. coli, Klebsiella pneumoniae, Proteus mirabilis, and then, as I said, nutrient deficiencies. Now, also issues with gut permeability, which is basically a condition known as leaky gut syndrome. That can also lead to the development of autoimmune conditions. But that's another video for another day. I'm actually doing another video called The Truth About Autoimmunity. You can check that out, and you can do so by subscribing and hitting that bell icon so you can get the notification when that video comes out. Uh, and so let's get into the remedies now. So number one on the remedy list is curcumin. Now, what is curcumin? Firstly, it's important to understand that in any inflammatory condition, whenever you see a word that ends with itis, that means there's inflammation. So anti-inflammatories are most likely going to be used. Uh, in the case of rheumatoid arthritis, typically anti-inflammatories are given. Now, if you're trying to cure the condition, these are not cures. No. If you're trying to reverse the condition, these are not going to reverse the condition to the point where you're going to be symptom free without medication or without supplementation. These are going to help you to control them, and they are much safer than the drugs that can have toxic effects and destroy your digestive system, like ibuprofen. If you look up the cause of ulcers, you'll find that excessive use of non-steroidal anti-inflammatories is one of the causes. So to avoid all of that drama, you can use some of these things, some of which can be incorporated into your diet. Now, you can get much more effective treatment by going to an Ayurvedic doctor and getting put on a protocol, which you'll follow for a few months, which can get you to the point where you can be symptom free. And there are studies on that as well. I've posted that on my website, drnishal.com. I'll talk about that more in a moment. Now, curcumin is first on this list. Curcumin is basically the active ingredient, the active phytonutrient or phytochemical that is found in the East Indian spice known as turmeric. It's this yellow spice, um, and it's typically used in East Indian foods, but it's also a part of Ayurvedic medicine. And it's been used for centuries. In fact, it's been used for thousands of years for a wide range of conditions, especially inflammatory conditions, and as well as certain metabolic diseases. And so it has a long history of uses. Now, in the case of curcumin, that's the extract of the bioactive compound. And in studies, it's been found that this can actually help in multiple autoimmune conditions, not just rheumatoid arthritis, but also lupus, ulcerative colitis, Crohn's disease, as well as osteoarthritis, which is a degenerative form of arthritis. Now, curcumin supplementation has been associated with a significant improvement in the symptoms of rheumatoid arthritis in comparison to a common pharmaceutical drug. So curcumin is number one on this list. Number two is boswellia. Now, you may find supplements that have both curcumin and boswellia in them. Make sure that whatever you decide to take, it's been recommended by a doctor that specializes in this type of therapeutics. That's going to be Ayurvedic doctors, that's going to be naturopathic doctors, and even functional medicine doctors. Now, boswellia is also an Ayurvedic herb. It's actually classified as a phytopharmaceutical in some parts of the world, specifically in certain parts of Europe. And again, this is also used in inflammatory conditions, mainly in inflammatory conditions, other things as well. But in the case of, like I mentioned, in the case of curcumin, boswellia has certain similar indications, such as ulcerative colitis, Crohn's disease, rheumatoid arthritis, obviously, osteoarthritis as well, asthma, um, and age-damaged skin, swelling of the brain, many other things as well that has been studied for. There's different forms of boswellia. In this case, we're talking about boswellia serrata, which is spelled Serrata. So in clinical studies, boswellia has been found to be very effective at reducing pain and swelling, and even the inflammatory markers like the ESR, uh, and uh, and even the stiffness as well in patients with rheumatoid arthritis. So that's another thing that you can use. Third on this list is black seed. Now, black seed is it's something that really gets a lot of hype these days. People make all kinds of claims about black seed and the hundreds of health benefits. And here's the interesting part: there's so many studies, so many clinical trials that have been done on black seed that many of these claims are actually substantiated. So let's talk about how it can help in rheumatoid arthritis. Much like curcumin, it's also an anti-inflammatory. It has many health benefits. I'm talking about not just rheumatoid arthritis, even Hashimoto's thyroiditis, again osteoarthritis. So in fact, all three of these help for osteoarthritis. It also helps to improve blood sugar levels, blood cholesterol levels, triglyceride levels, and it's useful if you Google or if you go to YouTube and you search for black seed, you're going to find hundreds of videos of people who actually lost a lot of weight using black seed. And they often combine it with things like apple cider vinegar, and it does actually work. And yes, I did try it personally many years ago, and it did help quite a bit. But in the case of rheumatoid arthritis, black seed is highly useful. That's due to an anti-inflammatory compound known as thymokinin that's present within black seed. Now, it's been used, like I said, in multiple clinical trials, including multiple studies on rheumatoid arthritis itself, and it's found to be highly beneficial at reducing the inflammation and the oxidative stress, as well as the disease activity and many of the key symptoms like pain, swelling, and stiffness. So, black seed is another remedy that can be very, very useful in this condition. Now, when it comes to diet, this is the foundation of our health. Our body is a product of nutrition. Now, in rheumatoid arthritis, there is a considerable amount of degeneration that takes place as well. So there's many aspects to how diet can be utilized in the case of rheumatoid arthritis. So number one on this list is anti-inflammatory foods. Obviously, why? This is an inflammatory condition. So we want to get anti-inflammatory foods. That's going to be foods like foods that have a lot of omega-3 fatty acids. So that's going to be things like salmon, mackerel, and then spices like curcumin, ginger. Uh, I'm going to actually post a list of anti-inflammatory foods in the description of this video or on my website. I'll always link an article to my videos, and you can get a list of anti-inflammatory foods, or you can just Google it and try to follow as many of those as you can, and make that the foundation of your diet, because inflammation is the foundation of this disease. Next is antioxidant rich foods. That's going to be things like blueberries, all types of berries, apples, even salmon, as I mentioned earlier. It contains astaxanthin, which is a powerful antioxidant. Selenium rich foods like Brazil nuts, and trying to make sure that they're all organic. Now, why are antioxidants so important? Well, as I said, there's a lot of degeneration that takes place. The way that anything degenerates is through the process of oxidation. So the best way to slow that down is to slow down the rate of oxidation, and that is done with antioxidant rich foods. So that's the next part of the diet guidelines. Last but not least is nutrient dense foods. The connective tissue that becomes damaged has to be regenerated. And in order to do that, you need certain nutrients. Now, connective tissue is made up of collagen. Now, collagen is believed to mainly be from protein, right? Most people think, oh, collagen, there's collagen protein supplements, and protein turns into collagen. Actually, there's a lot more to it than that. You need a lot of trace minerals to form collagen. You need vitamins like vitamin C. So just getting enough protein in your diet is not good enough. Now, I'm not saying supplement with collagen, although that has been found in, I remember there was one study that was found to be supplementation with collagen was found to be very beneficial in rheumatoid arthritis. However, making sure that your health is in a good place overall by supporting it with diet is going to be much much more efficient long term. You shouldn't become dependent on supplementing and popping pills for every little thing. You should solve the problem uh, at the roots. You should solve the problem where it forms from, and our body is a product of nutrition. So, getting nutrient dense foods, that's going to be things like nuts, seeds, kale, organ meats, um, certain seafoods like salmon, mackerel, sardines, even dark chocolate is nutrient dense. There's a lot of them, and I would recommend getting that into your diet. Of course, when it comes to organ meats, not a good idea in the case of rheumatoid arthritis when there's a lot of inflammatory activity going on. When that's taken care of and under control, then you can incorporate organ meats. But the rest of them can be highly useful. Even avocados are really rich in nutrients. Organic free range eggs are also rich in nutrients. Again, the inflammation needs to be under control first. So that's basically what's going to help you rebuild the connective tissue, get the disease progression under control with the anti-inflammatories, and get the degeneration from the disease progression under control with the antioxidants. Now, there's a lot more to it. There's many other things that can be done as well for the case of rheumatoid arthritis. If you want to get more information, if you'd like to get in touch with me, you can do so through my website. I do online consulting, so no matter where you are in the world, you can get in touch with me. And my website is drnishal.com. And so, yeah, no matter where you're in the world, if you need help, you can get in touch with me. I can help you. We can talk. And I'll see you in the next video. And if you have any questions, please feel free to leave a few comments, and or you can send me an email directly. I'll see you in the next video.